Now, we've heard quite a bit in the last couple of weeks about the emergency ordinance that's become known as the Sidewalk Ordinance, which required social distancing on sidewalks and streets in certain areas around the county and restricting the number of people who could gather outside in those areas. Now, after being in place for about 6-7 weeks so far, the board voted against making that ordinance permanent. Libby, we'll start with you. How did this all, what was the background leading up to this vote, and what had you seen in that time period?
Yeah, well, it's all about COVID and are trying to figure out how to handle it and how to live with it here. So what we were seeing back a number of weeks ago, remember we had quite a peak and then we closed everything down and we started to open things up, and of course our number of cases went up. And of course, we have a lot of people in Arlington, many of us wearing masks and social distancing, but particularly outside some of our establishments where there's, at night, there restaurants. We don't have anything. I think it's just only a bar. But as the hours got later, there got to be bigger and bigger crowds, and they were pretty close together, and people weren't wearing masks. And of course, as folks relax when they're drinking, they get a little more relaxed. They forget about the social distancing. So we were increasingly concerned about the way people were gathering and trying to encourage them. Our police and would try to kind of remind them to move apart, but it wasn't very effective. Sometimes people just didn't even pay much attention. And sometimes people even all have good intentions. They move apart, but 10 minutes later, it's a new group of people and they've forgotten because they're having a good time, which is what we want people to have a good time. So the manager, in talking to our public health, decided that we would maybe try being able to ticket people to make it, see if they could take it a little more seriously and really clearly posting where people needed to be standing apart. What was going on also at the same time was both Maryland and the District of Columbia, they were clamping down more on their having opened up, they were cutting back on hours. They were adding more restrictions, which seemed to possibly be attracting more young people to Arlington, which just kind of compounded the issue of spreading of the virus. So there's a lot we don't know about the virus, but we do know people standing in close proximity and talking and breathing on each other does spread the disease and is really problematic. So the manager was feeling at that point, with the changes going on around us and a concern about what we were seeing and a concern about an uptick, we just needed to right away do what we could. So this was an attempt to try to get people to separate and do the right thing. It had very mixed success. We actually didn't really enforce it to start much. We just kept trying to get a little tougher and a little tougher. We started hearing a lot of upset from people, thinking that they were going to get entrapped in a family of 4. Crossing the street would suddenly be close and they'd get a ticket. And of course, that wasn't the intention at all. And we kept saying, we don't want to give out tickets. We just want people to do the right thing. But in the end, and what happens is legally, under an emergency, we could adopt it right away. But then we have to re-adopt it and make it permanent, as you said, and that was for this meeting. And it was interesting how it went down, and I'll turn it over to Ms. Crystal in a minute, because I was the losing vote on this. It turned out it wasn't very, it wasn't really super effective. Our police were not finding it. It was difficult to enforce, sometimes maybe creating more problems than possibly it solved. I thought it made people to pay attention like they should, and I thought having that people aware that they really could get tickets made it a little more serious and gave us a little more oomph in our encouraging them to separate. But my colleagues didn't really agree, so it was a 4-1 vote. I lost, and I'll turn it over to Ms. Crystal to go talk for the other side.
Yeah, and I think Libby just had a great description of sort of the circumstances in which we found ourselves. I think for me, and perhaps for some of my other colleagues, this seemed like the most narrowly scoped way of tackling a problem, which we don't have evidence that this is causing the spread of COVID, the behavior at the late night restaurants. But I do think it's sort of undermining a lot of members of our community's faith that we're in this together. I think one of the things we've heard a lot is that why are bars open and schools aren't, right? And so we knew this was a challenge to try to tackle in some way, if only because of the fact that it's undermining that consistent public health message, which is the most critical thing to stop the spread. as Libby was mentioning, the way Virginia law is structured, there are not bars, there are restaurants that serve alcohol. And that means that any restriction on the category of restaurants is going to apply to the mom and pop pizza shop and their ability to serve beer after a certain hour or at all. The same way it would apply to a bar with a long line in front of it. So we sort of tried to narrowly scope it, see if we could tackle this issue. I think we heard loud and clear from community members that there was confusion and there was upset at this idea that we might be restricting folks' movement on the sidewalk. Libby talked about, I think we tried our best to try to be clear about, that this was really limited to, frankly, a handful of blocks in Arlington where there was clear signage. Nevertheless, I think it was ill-received for that reason. And then ultimately, it wasn't working. It wasn't changing behavior. I know that our police, frankly, had been harassed, in one case assaulted, trying to enforce this, which is a sign of how frustrating this behavior is and some of the individuals who are engaged in it. But what we also saw was that our police have been working for years with the Arlington Restaurant Initiative, which has basically had its origins in the years where drinking in Clarendon was frankly out of control. We would have a lot of negative impacts of that. So the ARI was founded to basically try to work with the restaurants as partners to see if they could control that behavior. And as a result, there is a strong partnership between some of our most popular nightlife spots and the police. And what we did see from the police was that they were able to engage the restaurants in, for example, expanding bollards, providing security to join the police to try to get this message out to the patrons. So insofar as I think most of the patrons are willing to listen, I think we have a way forward without this ordinance. And insofar as they're not, I think this ordinance was frankly causing conflict and more trouble for our police than a helpful tool. So going forward, I think that the next step is very much to kind of continue that effort, the sort of positive behavior. And I will note that inside most of the restaurants, we've seen compliance with the governor's orders. In the few restaurants where we haven't, we'll have the police available now to work with the public health team to shut that behavior down. This is, I think it was absolutely worth trying. I think it's not working. And I think that's probably where a majority of the board landed, that it was better to focus efforts, be it inside the restaurants or working with the restaurants on that outside the restaurant management as a way of moving forward.
What would your message be to those who go out to the restaurants in the evening, sometimes do have to queue up outside for quite a bit of time? The ordinance, will sunset at the end of September, I believe. And what will your message be to get out to these communities to keep it positive, to encourage that compliance?
Probably the same message we've always had, I think, Katie. We just won't say, or you get a ticket. I think we're just going to continue what we're doing. That was part of the reason I was okay continuing, because it's basically what we're doing. I don't think it's actually going to change. Yeah. I was really worried a little bit about the public messaging, that it's maybe not, doesn't seem so serious, but I don't think really that much will change. I mean, doesn't matter what we do, the virus is going to do what the virus is going to do. They don't care how we feel about it, what we do about it, but it's going to do its thing. And that means if you stand close to people for any length of time, you're very likely to get infected. If both of you are wearing masks, that will help. But basically, distance is the most important. That was one of the things that Dr. Verghese kind of made clear in his part of the presentation, was how important distancing is. Masks are good. And certainly everybody should be wearing a mask, but it's really important to distance.
That's exactly right. And I think it's probably worth noting, there was a lot of frustration. Why go after this particular group of people or this particular set of sidewalks? The point is we're trying to enforce congregating not happening in Arlington, because that is exactly, as Libby was saying, how this virus spreads. I think we've heard from a lot of people interested in a mask ordinance, particularly with our neighbors in Alexandria adopting it. But exactly as Libby was noting, the most important thing you can do is stay 6 feet away. If you're not able to, then the mask is, an important next step. Certainly masks are still required indoors, but simply staying 6 feet apart is, in fact, the most important thing you can do. And we will be continuing to put that message out and to enforce it, when it's happening at the inside of buildings, and working with the restaurants to try to manage it outside.
And we're going to start seeing changes because the weather's going to change, right? So there won't be so much standing outside. That's going to change. Flu may hit. Who knows what's going to happen with the pandemic? We're going to continue. I mean, it's just part of our effort to work with the disease and evolve. We tried this, and the thought was that it didn't seem to work very well. So we're going to be innovating. I say that the theme is innovating as we go, trying to figure out how to match the dangers of the virus with human behavior.